All right, everybody. So we're doing another video today, and our video is going to be based on how to find the right hospital bed for you. And we're going to go through the questions and answers that you're going to want to go through to determine what is going to be the best hospital bed model, what you need, and what the classifications are, prices, and different things. So as you can see here, we're in our Richmond, Virginia showroom. We sell pretty much all makes and models of hospital beds. We sell a lot of Hillrom and Stryker beds. Actually, right here behind me is the Hillrom Progressa, which we're going to get into and show you actually how amazing some of these beds are. And we're also going to kind of get into what you're going to get from insurance, what insurance might provide, what they might compensate you for. So, with all that being said, my name is Sean Callahan, aka Mr. Hospital Bed. I've been buying and selling hospital beds for the last 15 years. We go through hospital beds by the thousands right now in our Richmond, Virginia warehouse. We've got about 1,200 hospital beds down there. And a lot of these beds we send overseas. A lot of these beds go into nursing schools. A lot of them go back into hospitals, but a lot of them go into home care, long term care. And so, as somebody that's been doing this for a very long time, I like to give people information on kind of helping them find what's going to be the right option for them because every bed is different. Every situation for every person is different. And today it's going to just be kind of a general guide to help find you, kind of tune you in to some of the basic features that hospital beds have, what might be best for you, various price ranges, options. And with all that being said, let's get started. So, the first thing when you're looking to buy a hospital bed is going to be number one, how long do you expect to use it for? And if other videos I've said, there's times when you're getting a hospital bed and it might be for a knee replacement, it might be for a hip replacement, it might just be a short term rental that's needed. And in that case, sort of a generic bed or a sort of lower tiered home care bed might actually just be fine. Semi electric beds, many times, are going to be all you need. And semi electric is power head and power foot. And full electric is going to be power head, power foot, and then also get into a power up and down feature, so it's not going to be adjusted with a crank. Now, we do sell semi-electric beds that come like the kind you get at a mattress store that are super high quality. But what we're really known for are very high end medical beds and hospital beds that come actually out of hospitals. And normally, the companies that sell these now, this bed right here, the Progressa, is made by Hillrom. There's another version of the Progressa directly behind that. And then up over here, this bed right here is a Striker Secure 3. These are some of our most popular beds, and you get a lot of value out of a used and refurbished hospital bed. So the Progressive bed behind me, brand new, these beds cost $80,000 if you can wrap your head around that. Other versions are going to be 30 or 40 grand. And even the bed like the Striker Secure 3, that's a seven or $8,000 bed, and that doesn't include the air system or mattress or anything else. So there's a wide spectrum of different beds. And ideally, what you're going to figure out is, if you need a higher level of patient care, you're probably going to end up getting into a high end hospital bed or a high end home care bed or a hospital bed. But ultimately, you're going to find the most value getting probably out of a hospital bed because the cost of it'll be equal or less than buying some of this equipment brand new. And many times it does not have the same features. So, the very first thing that we do when we're talking to somebody about getting a hospital bed is we try to figure out how much time they're spending in bed. And if you've watched some of my previous videos, if you're spending the majority of time in bed or the majority of time in bed and sitting down, the ideal scenario is going to be to get a air mattress hospital bed. And the reason being is that if you're spending a lot of time in bed and you're sitting a lot, you're putting a lot of pressure on your tailbone and you're putting yourself at a higher risk of getting bed sores, pressure wounds, skin ulcers. They go by different adjectives, but primarily what it means is skin breakdown. And skin breakdown and bed sores are the number one reason that people get readmitted into a hospital after getting out of a hospital, is that there has been some type of an issue with the skin. And basically skin ulcers or pressure wounds or bed sores are really primarily caused by moisture and friction and basically a lack of circulation in that area, meaning that the person's in those prolonged positions in those areas for a very long period of time. And as somebody that's been in this industry for quite a while, I can tell you that as somebody that had to take care of my father, when it came time to helping get him in place and getting him done, I didn't have the resources in a little tiny town back in Minnesota to get this type of quality stuff there in the time that it was needed. And so me and my mom would be getting up and we'd be turning my dad, every 2, 3 hours, one of us would have to get up, and over the course of time, that actually really it really causes a lot of sleep deprivation, and it's not always going to be effective. So when you're getting an air mattress, that's really what that's for. Now, if the person's getting up and moving around and they're still mobile at some capacity and they're not constantly in bed or sitting down, then a foam mattress is fine. And some hospital beds, like this Progressa that we're going to look at here in a minute, come with an air system built into the bed frame. So the air system is going to be combined with the bed and it's going to work synergistically together. We'll show you, like, once again, how that's going to work. And then other beds like the Secure 3, which I have right over here. This is the Secure 3. You could start off with a foam mattress and then later add an air mattress system on there. So if it started out, or vice versa, you could start off with an air mattress and then later switch it out and put a foam mattress on there. So air mattress, foam mattress, that's the very first question you have to ask. Now, we really only sell, up higher tiered medical equipment because when people get home from the hospital and they find out what's coming from insurance, a large percentage of the time, that equipment coming from the insurance company is not going to be adequate to provide the level of patient care that that person needs. And many times, those people coming out of the hospital need an ear system, and they're not going to get that from the hospital provider. So that's an issue, that's a problem, and there's a few key factors that are gonna come with an air mattress that I just wanna run through real quick. So some of them you might need, some of them you might not. Primarily, one of the things an air mattress does is it allows the heels and the body to sink further into the mattress itself. So the areas that you're primarily going to have issues with skin breakdown are going to be the tailbone area, the bottom of the heels, and sometimes even the bottom of the elbow. Now, when your heel is sitting on a foam mattress, you might only have a very small percentage of that heel actually touching the surface of the mattress, and therefore all the weight of that leg is going into a very small area, maybe the size of a dime. But when you're on a air mattress system, the whole bottom of your foot is going to sink in, and therefore more square footage of the body is going to sink in, and it's going to put less pressure on smaller different areas of the body. So that's one of the first things that an air mattress is going to do, is it's going to extend the amount of contact with the areas of the body so that the body's sinking further in and it's not leaving, higher spots of the body sitting kind of supporting all the body weight. That's a huge thing. The second thing it's going to do, and a feature that you're going to see a lot, is a feature called low air loss. What is low air loss, and how do I know if it's effective, or how do I know if it's actually good? Low air loss can be done many different ways. Primarily, what it is underneath the mattress of your bed, there's air bladders, and those air bladders have little tiny holes that allow air to escape through the mattress. And what that air does is it circulates over the surface of the mattress. And what it does is it whisks away moisture to keep the skin dry. So remember, bed sores primarily are caused by moisture and friction. So if we can reduce the moisture in the skin and keep the skin dry, then we have a much greater chance of avoiding a bed sore. However, if you do have bed sores or pressure wounds, there's going to be a lot of moisture around that wound. So the low air loss also is going to run and circulate over that area of the body, and it's going to help dry up the bed sore. Now, the key thing about low air loss is that low air loss is only as good as the size of the pump and the size of the holes in the mattress. And what that means is that You could have a really low quality or just a low end air mattress system that has a little tiny pump and little tiny holes. And yes, it is circulating air over the surface of the mattress. However, if it's a person that's primarily in bed, it's not hospital grade equipment, there's still a very good chance they're going to get a bed sore. When we're dealing with companies and we're dealing with people that are primarily in bed that need a high level of patient care, we're selling stuff that's either very high tiered home care medical grade equipment, or we're actually selling hospital grade equipment where you've got a large compressor, a large pump, and it's pushing a lot of air to keep the skin dry. That's really important. So low air loss, that feature is only as good as the size of the pump and the size of the holes and the amount of air circulating over the mattress. And there's a huge difference between hospital grade stuff and home care grade medical equipment. So low air loss is always going to be one of the primary features that you're going to see in just about every single mattress that's sold. And that's going to be one of the primary features. Now, the other features that you're going to see are going to be alternating pressure, which means that every other air bladder will inflate and deflate. And if you can imagine, just to visualize, primarily most of these mattresses, 18 air bladders. They start at the head, they go down to the foot. On the far left and the far right, you're going to have little tiny holes releasing air. Now, those air bladders can, what we say, they can alternate. So they can deflate, inflate, deflate, inflate. That's what you're going to see in a home care air system is every other air. And what that does is it changes the points of the body making contact with the surface of the mattress. The hospital grade equipment that's going to be a little bit higher tiered is going to be every third air bladder. So 4, 7, they're going to alternate. But basically, the difference is on a home care air, alternating air system, every other air bladder inflates and deflates. That leaves you on a 50% of an air surface because half of it's inflated, half of it's deflated. On a hospital grade air system, you're going to be two-thirds supported by air. And what that does, it prevents people from bottoming out on the mattress. So, there's a difference between home care and hospital grade care. One of the differences is with alternating pressure, it's every third air bladder inflating instead of every other air bladder deflating. Now, sometimes that's important, sometimes it's not. Sometimes people are using alternating pressure as a regular thing, and sometimes they're not. Whether you do or don't, that would just be another consideration. The main thing is when you're spending money to buy medical equipment and you see an low air loss system for $1,000 and you see another low air loss system for $3,000 and you're trying to figure out what, they're both doing the same thing. What you're actually paying for in hospital grade equipment or higher end equipment is a bigger pump, bigger compressor, and running more air. So for people who are paraplegic, quadriplegic, ALS, MS, stroke, all those different types of things. You want to get hospital grade stuff or high end home care equipment because that level of patient care and avoiding bed sores in the long run is going to save you a lot of money by not and a lot of time and effort from having to be readmitted back into a hospital or even putting a lot of pressure on caregivers who are now trying to treat somebody that has pressure wounds, and that gets to be very stressful. And if the whole goal is really to avoid that. But the important thing is to identify why you're paying more for bed mattresses that all show the same features, but are technically, doing higher levels of patient care. So that's important to know. Now, the other thing that we're going to look at right now that I'm going to show you is a feature that's called lateral rotation. Okay. And lateral rotation basically means that the air mattress system is going to turn that person all night long. And there's going to be a separate set of air bladders underneath the bed on the right and the left. And one side's going to inflate, the other side's going to deflate. And that's going to basically allow the person to be turned automatically by the air mattress. So for caregivers that don't have the ability to do the turning, to have an air system, like for me and my mom, if we had that for my dad, that would have been phenomenal. But I didn't have access to that technology at the time and wasn't able to get that technology to where I needed to get it to. And with that being said, we ship hospital beds all over the United States and all over the world. And we have locations, San Diego, California, and I'm in beautiful Richmond, Virginia. But we ship these beds. We got beds next week going to Illinois, Texas, Tennessee, Alabama. We ship them everywhere, Florida. So that's also another consideration that is going to be there, that we can get stuff out to various areas. But lateral rotation is basically going to do the turning, and they're set up on timers, so you determine how often you want the person turned. But to have the mattress do that is a big deal. Now, the progressive bed that's behind me, which is the by far the best hospital bed made on the planet Earth, this bed does lateral rotation, and it also has another feature that almost no other beds have, which is called percussion vibration. And percussion vibration is quote unquote a pulmonary hospital bed. And a pulmonary hospital bed is a bed that basically is helping with the lungs to get fluids and congestion out of the lung area. So the pulmonary feature, if that's a big deal, you're really only going to get that with a progressive bed. All other mattresses really don't have it. The older version of a Progressa is a Total Care Sport 2, and the Total Care Sport 2 does also have it. However, that bed is over 10 years old. It's a hydraulic bed. It does require a higher level of maintenance. And if you can afford the Progressive, many times you're one service call away from upgrading from a Sport 2 Heel Rump P1900. Total Care Sport 2 is the official name, from getting a Progressive. So these are basic features. Now, all the beds are going to have a chair position. The Progressive bed is actually going to have a chair position where your feet touch the floor, but all other beds will have a chair position, and that chair position will allow them to sit up comfortably, and they can eat in bed, watch TV. So it's a very comfortable feature. And nowadays, just about all beds will have that, except beds coming from insurance providers. So that's also going to be an important thing to look at. And that is actually a chair position is actually coming from a feature that's kind of a mouthful called Trendelenburg. And Trendelenburg is named after a doctor, but what it does is it elevates the bed into different positions. And those beds, when they go into different positions, elevate the head above the feet above the head. So, feet above the head is really important because many times that's being used to help slide people back up to the top of the bed. And then the head above the foot is used a lot for cardiac related issues, where people have a cardiac or a heart condition and they need to be elevated so that their heart is about 30 degrees above the head. So these are all basic features that we're going to offer with all the beds that we sell. I'm going to show you real quick the progressive bed because the thing is just so incredibly amazing. And then I'll go through and show you some of the basic controls. All the beds are going to be very easy to use. The Progressive is a touchscreen system. You're going to see real quick that it's actually really easy to use. And the goal here is to find a bed that's going to fit the needs that you've got and fit the price range, right? So the Progressive obviously is going to be a higher tiered bed. However, you could go get a brand new home care bed and put a hospital grade or a high end home care system bed mattress on it, and you're not that far off from just getting a Progressa. So, with that being said, let's just go in real quick and let's take a look at the Progressa. Let's look at the touchscreen system here. And so the Progressive bed, as you can see, you've got a lot of different features. One other feature I'm just going to go into that I don't normally do is max inflate. Max inflate is always really there for an air mattress. You're going to hit that when it's time to get somebody off with a Hoyer lift or with a Hoyer entrance and exit. And max inflate helps you get the sling underneath the person and helps get them off the mattress. The other feature you're going to have is turn assist left, turn assist right. Now, all hospital beds with an air system have turn assist, and we also sell a bed called a VersaCare that's sort of a lower tiered version of the Progressa, and that'll have turn assist left, turn assist right. What that does, it turns the person over for about 15 minutes so that the nurse or the caregiver can switch out the bed linens or bathe the person, and then it'll bring them back. It will not do the all night turning, which is, again, that term in a hospital is called lateral rotation. In the real world, however, we would call that all night, all day turning or turning feature. Um, and so you have turn assist left, turn assist right, sleep mode, and then you also have patient comfort, where you can determine on here the you can set the firmness for the mattress based on what's good for you. And you can see here, I'm just pushing through these. Now, the feature that the Progressive is going to have that other beds don't have are going to be these two key features right here. And I apologize because I'm trying to talk and I know that it's wobbling a little bit. So be patient with me here. Um, but the first one is rotation. So as I said, I can go into rotation and I'm going to say, okay, it's turned every 26 minutes. It's at 60-degree turn. But you know what? I just wanted it a 30-degree or 40-degree turn. And then I'm going to go to here and I'm going to say, now instead of 20 minutes, let's do 25 minutes. And then I can come over here and say, okay, we're going to do 26 or whatever. And you can see that it's very user friendly. And then all I have to do is hit start, and now the mattress system is going to start doing all of the turning for the patient. So now the patient is going to be on an auto turn feature, and there's other mattresses that'll do the turning feature. Um, they're going to be, most of the time, they're not going to be set up into the bed frame with a touchscreen, but they'll hang off the foot of the bed, and you can still get this feature built in. But the auto turning feature, is a really big deal. And that's another feature that if you're getting an air mattress bed, you might need it, you might not. And so I'm just going to go ahead and stop the therapy because we don't need to really go much further than that. And then what I'm going to do is I'm going to get into, we're going to back up here. I'm going to get into P&V, which stands for percussion vibration. And once again, I can go low, medium, or high. So I'm going to say I'm now low. I'll go high, and then frequency of the beeps. You've got all these different settings, intensity, low, medium, and high. So it can be customized to whatever the need of the patient is. And then we'll go ahead and hit start. And you're going to hear it's going to start thumping the mattress. And it's kind of hard to see, but basically what it's doing is it's pumping the lungs and hitting the upper respiratory system. And so if you needed pulmonary, and this is used a lot with people, like I said, that have various health issues that um, might be COPD, it might be asthma, it might be anything related to the lungs. But if you needed a feature like that, the Progressa and or the Hillrom Total Care Sport 2 are going to be two of the best options. Now, also, I want to just go in. One thing I forgot to show you. Let me switch around here because I want to get to a different section of the bed. The other thing I want to show you are the control panels, and they're very intuitive, very easy to use. Um, but if you can see here, um, this is really just very basic. Now, the heel round bed, you can extend the feet out. So if you want to shrink the bed or lengthen the bed, you can get a few extra inches. If the person's tall, you can get some extra length on that. And then you've got the chair position, which all these beds, when you put it into a chair, it's going to just basically be push the button until it's into a chair. And then when it's time to flatten the bed out, you just push this and you're going to flatten the bed out. These are the Trendelenburg and reverse Trendelenburg buttons there. And this bed also has a boost feature, which basically means it's going to help get the person back up to the top of the bed. And then, of course, head and foot up and down. That's pretty simple. And the bed itself up and down. And this bed goes plenty high. All the beds and all the stuff that we sell here, like I said earlier, are going to be full electric beds. They're going to be hospital grade beds. Even the home care beds are going to be high quality. And so this is kind of what we do is we try to well, I don't want to say troubleshoot, but we try to find what are the actual needs, or really just provide the information to the person buying the bed on what some of the options are, right? Because not everybody needs a progressive bed. Not everybody needs to sit in a chair with their feet on the ground. The Secure 3 bed that I keep going to, it's so funny, everything's opposite here. This bed right here, that is a rock solid bed, and that does a chair position. You're still going to get in and out the side of the bed, and but that's fine. I mean, in some cases, that's all you need, and the price is going to be lower. And maybe you just need a basic full electric bed. We get calls every day from people with dementia, Parkinson's, Alzheimer's, ALS, MS. You can imagine that a lot of people are getting home. They're getting something from insurance. Oh, they already know ahead of time that whatever they're going to get from insurance probably is not going to be sufficient for what they need. And so therefore, they reach out to us and then we can say, okay, I can equip like that mattress. Um, if you can see right there, you just see that bit of orange on underneath that. As soon as I see that, and there's another one in the background up here. As soon as I see that, I know that that's a Striker gel foam mattress and isogel, highest quality foam mattress money can buy. It weighs about 50 pounds. That layer of gel that's in there is a very solid layer. And that's another feature that if you're going to get a mattress, we have mattresses that we sell brand new, but these right here, some of these are almost in new condition and we can clean them, sterilize them, and upgrade the bed with a really high end foam gel mattress. And then later, maybe you need air, maybe you never do, but the whole goal is to provide a very high level of patient care and a very high level of comfort. And so for us, that's really, one of the things that we're trying to do is to match the right bed for the right person and get into, what's going to be best for them in this scenario, what's going to be affordable, setting that whole thing up. Now we do have on the, selling the bed, honestly, that's the easy part is selling the bed. The more difficult part really is making sure that we have certified technicians. This is a Hillrom bed. We have certified Hillrom and former Hillrom technicians that go through these beds. So they're all patient ready. We have back end access so we can get service just about anywhere in the United States. That's a big deal because if there is an issue, we want to make sure that we can service or take care of the person once the bed has been purchased. And so these are some of the other things that are worth, taking into consideration. You think, wow, that guy's in Virginia. I'm in Texas. What happens? Well, it doesn't happen a lot, but it happens. And we want to make sure that we've got a net and we've got backup coverage to make sure that we can, get people into these different areas if there is a need for service, that comes out sometime in the future. So, these are some of the basic questions that you're going to ask and some of the basic things you're going to want to know when you're buying a hospital bed. Normally, what's happening is people are in the hospital for whatever reason, and the nurse or somebody in there says, hey, your family member is going to be discharged in 48 hours or 3 days. And then you got to figure out, oh my God, I got to get a bed. And, it's a very stressful time for a lot of people. So the goal for us is really just to give you as much knowledge and as much information on trying to figure out what's going to be best for you. Now we do sell, like I said, brand new home care beds. So there's many brands that we sell that are going to be very high end, very high quality, and if that's going to fit the need for what you need better, then by all means we're happy to do that as well. And so then that's going to be a whole nother scenario that we can play out. But like I said initially, normally some of these refurbished beds by Hillrom and Stryker are going to offer more value and give you a few extra benefits and a few extra features than what some of the home care beds might be able to do. But the whole thing is to provide options, to provide choices, to provide things in multiple price ranges, and to try to help you in any way we can to find the solution that's best for you. So I hope this video was helpful for you. I'm going to be doing additional videos. Again, my name is Sean Callahan. A company is USA MedBed. We have websites, the number one hospitalbeds.com and hospitalbedshop.com. And we're located in San Diego, California, and Richmond, Virginia. You can call us at either one of those numbers. And, if there's any information that you'd like to share, put it down in the comments. If you have questions, put them down in the comment section, and we'll be more than happy to help you in any way we can. We also sell the over the bed tables and cabinets, and we do sell other equipment. We pretty much sell everything that's in a hospital, but we're very well known and we specialize in hospital beds and medical beds. And we've been doing this a long time and we sell beds literally by the thousands. So thank you very much for watching the video today. Subscribe and share for new ones. Leave your questions in the comments and we'll see you on the next video. From beautiful Richmond, Virginia, this is Mr. Hospital Bed. Thanks again for watching. Have a great afternoon.